Now I would like to give the floor to Joao Breda for the second part. Joao is head of WHO European Office for Prevention and Control of Non-Communicable Diseases in the WHO Regional Office for Europe. Joao, you have the floor.
Thank you very much, Madam Chair. I am delighted to be with you today, and I would like to express my gratitude to our colleagues in WHO headquarters for the invitation. Good morning, good afternoon, and good night for all of you. I will be reporting and I will be sharing, if you allow me, a couple of slides. I will be reporting about a meeting that we organized recently, actually a couple of days ago, on the connections between the importance of fighting NCDs and misinformation. And please let me know if you can see my slides. So if you can just nod, perhaps I ask Madam Chair to say that, yes, we can
That's
see
okay,
the slide.
we can see your slides.
Thank you. So we are aware that disinformation and fake news are a growing concern as more and more individuals get their information from digital venues such as search engines, social media platforms. While generally the access to more information on health issues can be really positive, very good, the spread of inaccurate medical information is problematic, and we all know about the possible really negative consequences. We all know that NCDs have a huge impact in the morbidity and mortality and quality of life of citizens across the globe. We know that the impact of misinformation on COVID-19 outcomes has received a lot of attention in recent months. The impact of misinformation on NCDs management and control remains relatively unexplored. And this is why we decided to potentially look into this topic as well in our region. Despite, in fact, because 90% of the mortality in the region are actually related with non-communicable diseases and around 70% of the burden of disease. We also understand that there are ongoing activities and different levels of action that are potentially necessary. So we kind of in reflecting among the team and with stakeholders that perhaps it would be good to organize an initiative around this topic, misinformation and NCDs. And therefore we organized the first meeting. Normally we start with scientists and countries, but we decided we would like to start with civil society, hence and given their level of expertise. So this meeting that I'm reporting to you in terms of reflections was aiming to identify barriers, challenges, and possible ways to fight health disinformation at civil society level, discuss ongoing initiatives, debate the role of NGOs and also academia and their impact on policymaking, to assess the role of civil society and grassroots initiatives, discuss the impact of digital health literacy, showcase also success stories, and we discussed a lot of that. We already been advocating for that, and member states, particularly in the context of WHO, when it comes to NCDs, dealing with this misinformation and engaging and involving more civil society. And we thought it was a good idea and a good sign really to start from there. One of the participants said that COVID has shone a spotlight on this issue, but NCD misinformation has been around for a very long time. It is not enough to simply acknowledge it. We need to take action to fight the societal problem. So what we did, we understood that we would like to consult with, of course, member states, the different stakeholders, particularly the private sector involved, but also civil society. This is where we started, and we called it a triple entente. So the report I'm making today is basically related with the first meeting. So this will continue on civil society. We set up a small meeting a small working group in the region. We established a plan with a few things from, experts, academia, media, social media, member states. This is indefinitely being planned. And we were happy and very lucky to have among us series of very interesting minds from the civil society. And I would like just to share with you some quotes from some of them that you can see actually in the slides. One of them said, I'm excited to be with you at this action-oriented meeting, thinking about the way forward rather than simply characterizing the problem. We need to ensure that we move beyond the individual level towards the government and societal level. Another one said, this should start with prenatal parenting classes. We need to build from the ground up on the topic of media literacy. Not all internet sources are created equal. We want to encourage users to think critically whenever they are on the internet. Another one would say, we understand the importance of evidence-based clinical guidelines. We also need to embrace evidence-based communication strategies. And last one was saying, this is an unfair battle. The field is tilted against public health. My best friend, he was saying, was diagnosed with cancer. Before long, she was being deluded with health misinformation, mainly false cures. By the time she presented to medical professionals, it was too late. So we understood and we discussed that we have a few options. A dialogue of truth is very important. Correction by fast checkers is also something to be on the table. Votes for truth, legal options. These were some of the elements that, in fact, the participants in the meeting discussed. And then in discussing possible ways forward, they realized that we realized there are many initiatives ongoing. So maybe a certain level of coordination and learn from them and act is important. Showcase success stories and innovation, collaboration to develop action plans, listen to communities to understand the root causes, not just promoting our version, empower young generation. It is not only about the main post, it's about to follow up and to really engage. Influence tech companies to adjust that algorithm not to be manipulated. Some would say detox the algorithm, a very nice expression that we really found very, very interesting. And we are going to continue. This is what I can share with you. We will be also engaging specifically on NCDs, but a lot to learn from COVID and other areas on engaging with countries and with private sector, possibly in the near future. Thank you very much, and thank you for the opportunity.
Thank you very much, Pravin Gomez and Joao Breda, for this briefing on what has happened in your track, civil society track. I was very impressed to see your proposed solutions that will be driven by and for communities. I think it's very true that the civil society is very diverse. We have many views, but you have a shared purpose. And this shared purpose is something that we also share with you, which is health of our population and communities. I think your solution to shift words into action is a very good proposal, and that we need indeed community-driven approaches to build trust in our societies. Your proposal to build better literacy, infodemic and health literacy, I think it's very important. And I take your point on having a better translation of science, and we'll have a track on science later on. So I'm sure that they will also propose few things to make this happen. But at the end, I think you are really right that what matters is the will and the desire to change, and moving from a top-down approach to a bottom-up approach, but also a two-way dialogue where different constituencies of the society can discuss and share experience and solution to this infodemic situation. What I really appreciated from our colleagues from Euro office is that he highlighted first the link between NCDs and infodemic, but also COVID-19, because we all know that at-risk people for COVID-19, severe COVID-19, are people with underlying condition, and many of them are non-communicable diseases like diabetes, so cardiovascular disease. So it's very important that we are united on this front as well, that information on non-communicable disease should align with what we say on COVID-19. but also that infodemic, even if the hot topic currently is vaccine and immunization, infodemic is much broader than that, and we need to also look at other topics that are circulating. And what also is very important is to move from this individual approach and individual-centric approach of health to the health of the communities, because this is another layer that is also extremely important, and specifically during pandemic. And what I learned as well is preparedness for infodemic management start in peacetime. And maybe when this large pandemic is over, and I hope it will be soon, we need also to reflect how we can keep the momentum and continue the effort and the collaboration to be much more resilient for the next pandemic.